Hi, my name is V.kelley, and I did my persuasive speech on nursing shortage. So how many of y'all have a nurse in your family or have a family member that is critically ill and it inspired you to become a nurse? So as a nurse working 12-hour shifts, usually 3 days a week, it's more of just taking care of the patients. It's educating them, it's taking care of the total care of patients, talking with the doctors, and talking with the family members. So I'm here to tell you today about nursing shortage, and it is due to nurse burnout. So what is nursing shortage? Nursing shortage is defined in relation to existing levels of demands that are not met either in the present or in the past, and also in the comparison of existing nurses and those still in the institutions of learning. So nursing shortage can affect patient care in many different ways, but these are the top reasons. Staffing ratios, health, overworked, working overtime. It affects your family and home life, and it leads to usually being unhappy with your career. So as you can see, according to nurse.org, here are the usual nurse-patient ratios that you need to have care for your patient. You can see that it's usually 1 nurse to 2 patients in the more intense units, and then telemetry and step down 1 to 3, 1 to 4. So health. According to the Department for Professional Employees, working long hours with inadequate staffing affects nurses' health, increasing their risk for musculoskeletal disorders, affecting their back, neck, shoulder, hypertension, cardiovascular disease, and depression. And here you can see that it has the nursing stress points, hazardous substances, lower back pain, strained back, always being worried, so it leads to stomach problems, leg problems, falls, and foot pain. And the number 1, sensory overload. So being overworked and overtime shifts. This negatively affecting individual nursing as a whole. So it's unsafe and stressful working conditions that have caused 1 out of 5 new nurses to leave their job within 12 months of working. And you can see here 1 out of 3 nurses leave within the first 2 years of starting their first job. So burnout that comes from being overworked and feeling pressured to take on more patients and responsibilities is unsafe. It affects your home life and family, because if you have children, you miss out time with your children. It can lead to many marriage problems because you're not home, and you miss a lot of family events and holidays. All of this usually leads to you being unhappy with your career. You're stressed out all the time when you come home. You're burnt out within the first or second year of starting the job, and just overall, you're just taking over a major workload with every shift. So how can we solve this? Lowering nurse to patient ratio. It increases the number of nurses in employment to have better outcomes for their patients. Hiring more nurses so they're not having to work overtime or staying over their shift, 12 hours. Increasing the number of employment positions, which means basically having 1 nurse to 3 patients versus 5 to 6. And increasing the pay. Increasing the pay can lead to a nurse feeling more appreciated for all the stuff they do. So once we fix this, nurses will be able to provide full patient care. So you're able to care more for your critically ill patients. You'll be able to spend more time with them so you can actually give them great care. Providing education to patients. You'll feel like you actually educated them and taught them something, so you'll have a less chance of readmission instead of seeing the same patient within a week for the same thing. And you'll also have better health outcomes, which nurses will feel like they actually made a difference in somebody's life because you'll feel like you made a difference because they're not back in the hospital. So, you might not think that this is an issue regarding nursing shortage, but is one of the #1 reasons why they have a nursing shortage in the USA. You might not think that being able to give total direct care to a patient will help burnout, but if nurses actually have the time to sit down and educate their patients on how to take their medicines or how to check their blood sugar and have them demonstrate it back, you will feel like you actually made a difference and actually know that they understand. So here you might think that, well, a thank you and a smile can go a long way with a nurse, because as you can see, it's more of just taking care of a couple patients for 12 hours. It's a lot more, which leads to long work hours, 13-hour, 14-hour shifts. So think about if you were diagnosed with a chronic illness and you knew nothing about it, and a nurse just handed you a piece of paper and said, here, go take these medications. They will be able to sit down and educate you. And also another big thing is when you are being admitted into a hospital, you will feel, if you have better ratios, your nurse, it would be a good thing not to see your nurse running around just throwing your meds to you. And that is it. Thank you.